What are the latest advances in treatment of stomach cancer? So as I was mentioning, chemotherapy is the primary modality of treatment for stage 4 stomach cancer. Apart from this, we have certain recent advances for treatment of metastatic stomach cancer. The first thing is we call it as targeted therapy. Now what we are doing is targeted therapy is that in stomach cancer, we are testing for certain mutations in the tumor tissue, and if those mutations are detected, we are using specialized drugs against those mutations that help us in giving better responses in the treatment of stomach cancer along with chemotherapy. We call this as targeted therapy, and one of the commonly used targeted therapy medicines for stomach cancer are anti-HER2 targeted therapy. Apart from this, we also use certain specialized medications called anti-VEGF therapy as well, which is also a form of targeted therapy. Now, a recent advancement in the treatment of stage 4 stomach cancer is immunotherapy. What exactly is immunotherapy? So, basically, every one of us has certain immunity against cancer as well. But cancer patients, they have a reduced immunity to mount against cancer cells. So, what we are doing is we are using certain special medications to boost that immune system of that patient that activates the lymphocytes of the patient, resulting in a good response against cancer cells. So we are basically strengthening the patient's immune system to fight against cancer cells. We call this as immunotherapy. So what are the pros and cons of immunotherapy? The main advantage with immunotherapy is that it is relatively safer, has much lesser side effects compared to chemotherapy alone, and it has better responses as well. So the disadvantages of immunotherapy is that not every patient will benefit from immunotherapy. So we need to do some special tests on the tumor tissue, and if these tests turn out to be positive, then that patient will benefit from immunotherapy. If the test is negative, then the patient may not get benefit from immunotherapy. Apart from this, cost issues and availability are also a problem with immunotherapy and targeted therapy. So these are certain disadvantages of immunotherapy and targeted therapy.